acne got worse after starting benzoyl peroxide, this is not something you should ignore. Because for some acne types and skin types, benzoyl peroxide doesn't just irritate your skin, it can actually trap you in a dangerous cycle of more inflammation, more breakouts, more redness, and deeper acne scarring. And the scary part? Most women get told this reaction is just purging. It's not. It's something else entirely. So before you keep using benzoyl peroxide, you need to check whether your skin is one of these types most at risk. Hi there, my name is Cheryl Woodman. I'm a scientist, acne expert, and award-winning skincare formulator, here to help you get back to your clear, calm, confident skin. I'll always remember the day a pharmacist handed me a bottle of benzoyl peroxide. It was Panoxyl face wash, and he told me, but be careful, it can bleach your skin. Honestly, I had so much fear about making my acne worse and causing more damage and more flare-ups that I just hid that bottle of benzoyl peroxide in the depths of my bathroom cabinet. I buried my head deep in the sand and went on struggling in a constant cycle of self-confidence sucking breakouts. But I don't wish that time away, because it led me here today to helping women like you heal naturally from acne without harsh skincare and without harsh acne medications. There are 4 skin types who should never ever use benzoyl peroxide as an acne treatment, because for them, benzoyl peroxide is a hidden danger that will make their acne worse, not better. And the 4th type is one almost nobody gets warned about, but shockingly, it's the most common. Right now, you might be trapped in this devastating treating healing cycle, watching your self-esteem being destroyed, and the last thing you want is for an acne treatment to make it worse. But honestly, I've seen it happen so many times from my clients when they first come to me. The worst I've heard, and I've heard a version of this story more than once, is that my client got put on a benzoyl peroxide treatment and their acne flared up really badly. The worst it's ever been. And we're talking large cystic breakouts, papules, pustules, the kind that go really deep into the skin and leave not just the dark marks behind, but the indented acne scarring too. When the treatment made their skin flare up worse, they go back to their doctor, because their doctor is the person who stops this from happening, right? Then they walk away with another prescription, a prescription for a steroid like prednisone. This is how you spell that weird sounding word. Steroids pretty much switch off your immune system, so inflammation levels drop. And that can also help you to get rid of inflammatory acne temporarily. But so often I've heard that it didn't work, which isn't really scientifically surprising. And the whole treatment regimen actually left them in a worse place than before. This is usually because they had one of these 4 skin types who should never ever use benzoyl peroxide. And what's scary is that the women most at risk are usually the ones using benzoyl peroxide the most consistently, because they think that that irritation means it's working. So make sure this isn't you before following advice to just push through the purge, because often that's not a purge. That's your skin freaking out because benzoyl peroxide is doing something very damaging to your skin. But before I share more, you need to know something important about benzoyl peroxide, and this might shock you. Benzoyl peroxide will cause damage to any skin type, because, as this science paper so clearly states, benzoyl peroxide is a strong and savage oxidant. That's the complete opposite of an antioxidant. Oxidants cause damage, antioxidants help prevent damage. This is important because if you have one of these 4 skin types and you've been using benzoyl peroxide for months without symptoms, it doesn't mean all is okay. It's like a sink slowly filling with water. That water is benzoyl peroxide irritation. The floor doesn't get wet until one day your sink suddenly overflows. That's when your skin starts screaming. But that's not going to be you, because you're about to discover if you have a skin type that should never use benzoyl peroxide. So does this describe you? Your skin feels dry and oily all at the same time. I see this in so many of the women I work with, and the conversation often starts with, I'm not sure what my skin type is. It's dry and oily. And they pause as if waiting for me to tell them that that's impossible and they're a complicated case. But the truth is, this is the most common skin type I see. Or your skin type is just dry, and you often see scaly skin or even skin flaking. Your skin is consistently thirsty. It feels like even applying moisturizer 3 times a day wouldn't be enough. Your face feels stiff when you smile. It's that feeling of being aware of your skin when you shouldn't be. Or your skin looks shiny. Do you tick any of these boxes? If you do, stop using benzoyl peroxide. It is not the treatment for you, and I'm about to tell you why. See, these 5 symptoms, they are strong indicators you have a broken skin barrier. Your skin barrier is like a raincoat. It keeps water locked into your skin while also stopping bacteria getting into deep layers of your skin. It's like the most powerful security guard. But these are all symptoms that your security guard is starting to fall asleep on the job. Heck, maybe your security guard is fully asleep. And guess what benzoyl peroxide does? Just like this science paper found, it looked at what benzoyl peroxide does to your skin's microbiome and to your skin barrier. Well, they found that benzoyl peroxide does damage the skin barrier. That's what that bit highlighted in yellow means. But wait, it gets worse. Look at this, where scientists found, so let me read this with you, epidermal barrier dysfunction contributes to acne exacerbation, or in normal words, when your skin barrier is poorly, acne symptoms get worse, which is the crazy paradox of benzoyl peroxide and a big hidden danger, because if you fit profile number 1 of having an already poorly skin barrier, then using benzoyl peroxide is likely to worsen your acne. Not because it's purging your pores, but because it's wrecking an already poorly skin barrier. Your security guard was sleepy, but now benzoyl peroxide killed him off. That's a really poorly skin barrier, and I see so many women being told, just push through. Flare-ups with benzoyl peroxide are normal. Keep going. It'll get better. That's just not true. Most of the time. Most of the time, this is irritation-induced acne flares, and you need to stop right now to avoid acne scarring. That's why benzoyl peroxide is not an active ingredient I recommend inside my Acne Warrior program. Instead, we focus on following a specific science-proven protocol that naturally repairs your skin barrier so your skin starts to naturally resist acne and heal faster. That's the big sign your skin is on the path to healing from acne once and for all. Now to profile 2. This is perhaps the most important. You fit this profile if you have eczema, an eczema-prone or tending skin type, or you have sensitive or hypersensitive skin. See, we know that, and let me read this with you, skin barrier dysfunction is the initial step in the development of AD. AD stands for atopic dermatitis and is the most common type of eczema. So the first step to seeing symptoms of eczema is the skin barrier getting really poorly. That's exactly what benzoyl peroxide can cause. This is why if you're eczema prone or eczema tending, you shouldn't ever use benzoyl peroxide for acne. It's like going to the hairdressers when you have no hair left to cut. If this is you, no matter what your doctor or derm says, do not ever use benzoyl peroxide. This is unless you want to see a worsening of your acne and a worsening of your skin sensitivity or eczema. But I don't think that's the case, right? Okay, you're doing so well being here and checking to see if your skin type will be okay using benzoyl peroxide. You're so smart and so savvy, and it's important you stick around for these next 2 acne types, because if you fit more than one of these types and your doctor or derm offers you a prescription of benzoyl peroxide, you should run out of their office like you were sprinting away from a ravenous anaconda. Now, If you believe more women need to know this, please will you hit like on this video. It really helps YouTube get this in front of more women who are struggling with their skin. Thank you so much. Okay, so the third skin type that should sprint away from benzoyl peroxide like it were a ravenous anaconda is rosacea-prone. This is also a box you can tick if your skin type often reacts with redness. Now, I'm not talking about your skin getting red for a few minutes after you've washed or after you've applied skincare, but if your skin gets reddened easily and stays like this for hours, this is you. You also tick this box if you get burning sensations in your skin. This can be after using skincare products, or it can be induced by stress or hormonal changes. It's super important, in my opinion and experience, to avoid benzoyl peroxide if you have rosacea or rosacea-tending skin, because of what this science study tells us, that the skin barrier permeability, which in human speak is how poorly your skin barrier is higher in rosacea patients, and shockingly also higher than in people who have atopic dermatitis, the kind of skin condition you associate most with dry skin and red skin. Now, plot twist, you might not have heard this, but the FDA recently approved a benzoyl peroxide treatment for rosacea, and my heart sank. Because benzoyl peroxide is an oxidant, and you and I both know that oxidants cause damage to the skin. We also just saw how rosacea-prone skin types have a very poorly skin barrier. They need tender love and care, not Dalek-like extermination. That's my opinion, at least. See, the treatment that's been approved for rosacea is a very specific form of benzoyl peroxide. It's an encapsulated benzoyl peroxide at 5%. You can think of encapsulated benzoyl peroxide like sponges soaked with benzoyl peroxide. When these little sponges get put on your skin, they gradually release the benzoyl peroxide, which means less irritation. But it doesn't mean less oxidation. It only means your skin gets the same dose just over a longer time. Rosacea skin types are skin types that have baseline stress levels way higher than the average. That's partly because of the poorly skin barrier. So in my scientific opinion, nothing good comes from adding in more stress with an oxidizing active like benzoyl peroxide, especially not when there are other treatment options that are much gentler to skin. If you need this type of skin support in your life, please hit subscribe. It truly helps this channel grow so I can continue to help you and other women like you who might be struggling and feeling so helpless right now. Thank you. Okay, now this fourth skin type is a little different. This is the one most women never get properly warned about. And the kicker is, out of all these skin types or skin profiles, it impacts by far the most women. I call this type, who should reconsider benzoyl peroxide use, the mixologist gone wrong. Because using benzoyl peroxide with certain acne skincare is like running a marathon without nipple cream. Your skin can get red raw. Two of the biggest culprits are acids like salicylic acid and high-strength retinoids. And don't worry about writing these down. I've got something coming up soon that you can grab instead. Okay, so salicylic acid, it's such a common acne treatment, right? But here's the thing, it's an exfoliant. And you know what exfoliants do? They take away layers of your skin barrier. We also know benzoyl peroxide is super stressful to your skin barrier. So combine these two together and you're getting into red raw marathon nipple rub territory. There are way too many incompatibilities for me to list right here. So if you're serious about avoiding a full-blown skin barrier nightmare, grab your free copy of my benzoyl peroxide compatibility matrix. It shows you exactly what you should never mix with benzoyl peroxide because it can seriously devastate your skin barrier. Plus, the ingredient combinations that can make your expensive acne serums completely ineffective. I'll leave the link in the description. So, in a perfect world, I would love for you to stop using benzoyl peroxide if you have an already damaged skin barrier, or if you are eczema prone or sensitive, or if you have rosacea, or if you are using lots of active ingredients. But if you tick 2 or more of these boxes, I want you to run away from benzoyl peroxide as if it were that giant anaconda snake coming to eat you. But, and this is really important, do not go cold turkey. If you've been using it for months, going cold turkey can send you into the worst rebound acne flare of your life. That's why I have a step-by-step benzoyl peroxide wind down guide inside my Acne Warrior program. I'll leave that link in the description too. Now, if you're sitting there thinking, okay, so should I stop salicylic acid and just stick with benzoyl peroxide instead? Careful, because what actually clears cystic acne fastest might completely surprise you, and choosing the wrong one can keep your skin trapped in an inflammation cycle for months. So, before you decide which treatment to keep using, watch this next video right here. And if you don't see the video here, it's because I've not released it yet, in which case hit this subscribe button, and I'll see you in a week.